And with India in the grip of a second COVID-19 wave, a report titled Managing India's Second COVID-19 Wave, the Urgent Steps, highlights the key points of the second wave of the pandemic. It has recommended steps that are specific to India, steps that should be taken now to help slow down the spread of the infection. Interestingly, this includes no blanket lockdowns. Instead, it advocates creating micro-containment zones in high caseload areas. Rishika Barua has all the details of this study.
The Lancet Commission has come out with a whole host of recommendations amid an acceleration in COVID-19 cases. For 2 straight days, India has reported over 2 lakh cases. The Lancet Commission has recommended a complete ban on public gatherings of more than 10 people for a period of 2 months. They are suggesting that all districts to which people are returning from such mass gatherings should also be monitored for any kind of surge. The Lancet Commission has also recommended an accelerated vaccination drive for the government to be able to meet its target of 5 million vaccinations per day. It's also interestingly made an appeal to include all adults, even those below the age of 45 who have comorbidities, into the vaccine priority group. The Lancet Commission also recommends that teachers and school staff should be vaccinated on priority so students can go back to school. Also recommending to the government to approve a broader mix of vaccines and also ramp up the current manufacturing capacity in the country. It's interesting because the India COVID Task Force is also in fact urging the government to monitor and report on adverse events following inoculation. This will of course go a long way in inspiring confidence among people as well. Interestingly, it also talks about an amendment to the RT-PCR form to include information on whether an individual has received 1 or both doses of the vaccine. It's talking about an expansion of genome sequencing. This is extremely important. What India is seeing right now is a rapidly spreading strain of coronavirus. The pace at which new infections are rising in the country is unprecedented. So the Lancet Commission is recommending that at least 5% of all cases every month on a continuous basis should be monitored for variant strains of COVID that could be spreading across India. Lastly, it also talks about no blanket national or state lockdown. Instead, urges the government to focus on micro-containment zones, especially in areas where the caseload is very high. It's also talking about, lastly, international travel, that all passengers coming in from abroad should be subject to a 7-day institutional quarantine, and on the 8th day, there should be a mandatory RT-PCR test, after which their quarantine should end.
And here's a new medical update. A new assessment in the medical journal Lancet has found consistent and strong evidence that the SARS-CoV-2 virus, which causes COVID-19, is, as the report says, predominantly transmitted through the air. Therefore, they say now that all public health measures that fail to treat the virus as predominantly airborne are leaving people unprotected and allowing the virus to spread. This report goes on to say, this Lancet study says that the transmission rates of COVID-19 are much higher indoors than outdoors. It says that the transmission is greatly reduced by indoor ventilation. By contrast, the team found little evidence that the virus spreads easily via large droplets which fall quickly through the air and contaminate surfaces. The new work has serious implications for public health measures designed to mitigate the pandemic.